Hi, I'm Wendo, and I will be teaching you the muscles and fascias of the neck using pictures and transverse in the transverse drawing. So here we have the transverse drawing of the neck, and the four main fascias are the superficial investing cervical fascia, your pretracheal fascia, carotid sheath, and your deep investing cervical fascia. The other two fascias here, the alar fascia and the buccopharyngeal fascia, are not as important as the other four I mentioned. Doesn't mean you shouldn't know them, but not as important. The alar fascia has more clinical relevance when it comes to infections, and then the buccopharyngeal fascia includes your buccinator and then your pharyngeal constrictor muscles. As I move on, I will be talking about the muscles in each layer, the function of the muscles, the origin insertions, and what innervates each muscle. So starting with the superficial investing cervical fascia, we have the sternocleidomastoid and the trapezius muscle found in these fascias. However, the trapezius muscle is considered a muscle of the back, so I will only be talking about the sternocleidomastoid and then the platysma, which sits ventral to the superficial investing cervical fascia and directly under the skin. So the platysma originates from the pectoral deltoid fascia and inserts on your lower margin of your mandible. This muscle is innervated by the cervical branch of the facial nerve. This muscle doesn't really have a significant function, so I will not be dwelling on that. Then you have your sternocleidomastoid. As stated in its name, it originates from the sternum and the clavicle and then inserts on your mastoid process, which is part of the temporal bone, and your superior nuchal line, which is found on your occipital bone. This muscle is for ventral flexion, so bending your head forward, lateral flexion, which is to your side, and the rotation of your neck. And this muscle is innervated by the accessory nerve. The accessory nerve also innervates your trapezius muscle. Moving on to the pretracheal fascia. The pretracheal fascia is where you can find your infrahyoid muscles. Your infrahyoid muscles, your trachea, your esophagus, and the thyroid gland, and also the recurrent laryngeal nerve. This nerve comes from is a branch of the vagus nerve, which I will show you later on in a different diagram. The infrahyoid muscles and the geniohyoid are innervated by the ansa cervicalis, which is part of the cervical plexus. The mylohyoid is innervated by the mylohyoid nerve, which comes from the mandibular branch of the trigeminal nerve. Your stylohyoid is innervated by your facial nerve, and the digastric is broken into an anterior and a posterior branch. The posterior branch is innervated by your facial nerve, and the anterior is innervated by your mylohyoid nerve. And I will show you why in a minute. So starting here, we have your omohyoid, which comes from the scapula and inserts on your hyoid bone. This is your sternohyoid, which originates from the manubrium and inserts on your hyoid bone. This is your sternothyroid, and this is your thyrohyoid. So sternothyroid, manubrium of the sternum to the thyroid cartilage of your larynx, and then thyrohyoid, thyroid cartilage to your hyoid bone. All the thyroid hyoid muscles depress your hyoid, so move it down, and those which are attached to the thyroid cartilage will also depress your cartilage. And here we have your digastric muscle. So the digastric posterior branch will come from your mastoid notch and insert on the hyoid bone. And the anterior will come from the hyoid bone to your digastric fossa, which is found on your mandible. The two bellies of the muscle are attached by a tendon which connects it to the hyoid bone. So this is why the posterior is facial nerve and the anterior is mylohyoid nerve. So this is your mylohyoid muscle. So it's attached to the mylohyoid line of your mandible and inserts on your hyoid bone. And then your geniohyoid comes from the mental spine of your mandible to your hyoid bone. And then the styloprocess from your temporal bone to the greater horn of the hyoid bone, which makes the stylohyoid muscle. The suprahyoid muscles are all function in elevating, so rising your hyoid bone, and those which are attached to the mandible will depress the mandible when contracted. So this is your carotid sheath, the purple with the purple outline. This is your internal jugular nerve, your common carotid artery, depending on where the drawing is taken or the level. But at this level of C7, it is the common carotid artery. If you were to draw it higher up around C4, you would have two branches, the internal carotid and the external carotid. But this is your vagus nerve, which is where the recurrent laryngeal nerve branches off of. And then this is your sympathetic trunk for the sympathetic nervous system, and then the phrenic nerve, which is a branch from the cervical plexus. So here I will be talking about the muscles in the deep intestine cervical fascia. You have the scalene muscles. There are three of them, the anterior, middle, and posterior scalene muscles. All of the muscles are innervated directly from the spinal nerve. So there's no need for like specific names. If you just say spinal nerve, that is enough to get the marks. But the anterior scalene originates from cervical vertebrae 3 to 7 and inserts on the first rib. And then the middle is cervical vertebra 3 to 7 on the first rib. I've made an error. Anterior scalene is cervical vertebra 3 to 6, sorry. And then the posterior behind the middle, cervical vertebra 5 to 6, and inserts on the second rib. All these muscles are involved in accessory inspiration as they are attached to the rib cage. So they will help expand, they will help move the rib cage up so that the lungs can expand. And then these muscles also do ventral flexion and lateral flexion. Here you can also find the longus colli and then the longus capitis. The longus capitis originates from cervical vertebra 3 to 6 and cervical vertebra 3 to 5 on the transverse process, and then inserts on the basilar part of the occipital bone. Here you have your rectus capitis anterior and rectus capitis lateralis. The rectus capitis anterior originates on the transverse process of the atlas bone, transverse process of the atlas, and inserts on the jugular process of the occipital bone. And then the rectus capitis lateralis will originate on the lateral masses of the atlas and insert on the basilar part of the occipital bone. All these muscles are involved in lateral flexion apart from the longus capitis. And then the rectus capitis anterior and the longus capitis and the longus colli are involved in ventral flexion. Thank you very much for listening. I hope you understand.